This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. Most people thought polio was a disease of the past. It's something many people only remember from history books. Iron lungs, paralyzed children, hospital wards dedicated to infectious disease. But recently, public health officials issued a new advisory related to polio vaccination coverage. When headlines like that appear, people sometimes assume it means there is a new outbreak. But inside healthcare systems, those advisories mean something very different. They are not panic announcements. No, they're not. They are early warning systems. And they are one of the ways public health prevents diseases from returning. So, when public health officials issue an advisory about a disease like polio, they are not saying there is a widespread infection. What they are saying is that something in the monitoring system has changed. Public health systems constantly track several indicators. Things like vaccination rates, wastewater surveillance, isolated case reports, travel patterns, and regional immunity levels. If those indicators suggest that protection levels in a population are dropping, officials issue an advisory. The goal is not to alarm the public. The goal is to prevent problems before they start. Diseases like polio are controlled through something called population immunity. You may have heard that before. When enough people are vaccinated, the virus struggles to spread. Even if it enters a community, it has difficulty finding a new host. That protective barrier is often called herd immunity. Now, that term you may have heard. But that protection only works when vaccination coverage stays high. So if coverage drops below a certain level, the protective barrier weakens. And that's when public health officials begin issuing advisories. Not because an outbreak has already happened, but because the conditions that prevent outbreaks may be changing. Inside hospitals, these advisories are taken very seriously, not because staff expect to suddenly see large numbers of cases, but because healthcare systems are trained to watch for early warning signs and signals. Nurses, physicians, and infection prevention teams receive ongoing education about infectious disease surveillance. Hospitals track things like unusual neurological symptoms, clusters of unexplained illness, pattern of vaccine preventable diseases, and this type of monitoring allows healthcare systems to detect potential threats early. In many cases, the public never even hears about these internal surveillance systems. They don't know about it. But they operate constantly behind the scenes. Another reason these advisories matter is generational experience. Many younger healthcare workers have never encountered a polio patient. I have never seen one in my career. Vaccination campaigns dramatically reduced cases in the United States decades ago. At one point, in the early 20th century, polio outbreaks filled hospitals with patients suffering from paralysis. Entire wards were dedicated to caring for them. Devices like iron lung were used to help patients breathe when their muscles were paralyzed by the virus. See, today, most healthcare workers only learn about polio through medical history. That's the knowledge that I have. And that's the knowledge most of you have. But public health systems continue monitoring the disease because viruses do not disappear completely. Let's get that straight. They remain controlled through vaccination and surveillance. This is not a political conversation, but it's just how the vaccine works. Public health systems function a bit like smoke detectors. Their job is to detect problems before they turn into fires. We have wastewater surveillance systems that monitor viral particles in communities. Epidemiologists analyze vaccine coverage data. Hospitals report unusual infections to regional health authorities. These systems operate quietly in the background of everyday life. But when indicators change, advisories are issued, not as a sign of panic, but as a signal that the system is doing exactly what it was designed to do. Let's talk about what healthcare workers understand. Inside healthcare, advisories are not viewed as alarming headlines. They are viewed as information. Information that helps hospitals stay prepared. Information that helps public health teams understand changing risks. And information that allows communities to maintain protection against diseases that once caused enormous suffering. Many of the systems that protect public health are invisible to the public. People rarely see the surveillance networks, data analysis, and monitoring that operate behind the scenes. But those systems are one of the reasons diseases like polio became rare in the first place. And when advisories appear, they are often a sign that those systems are doing exactly what they were designed to do. Identifying potential risks early so they never become crises. Hit that like button, subscribe, hit that notification bell, and I will see you in the next one. This is The Broken Shift. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.